NHS England has a mandate commitment to ensure everyone has easier and more convenient access to GP services, including appointments at evenings and weekends. Based on local evidence, services are required to address issues of inequalities in patients' experience of accessing general practice. NHS England has endorsed a patient pathway approach to addressing inequalities, which has been developed by the University of East Anglia. The pathway is part of a new resource that will help commissioners and providers consider how inequalities might arise when people are accessing general practice services. Step 1. Difficulties in recognizing health problems. Those who are, for example, socially isolated or with poor health literacy may struggle to recognize health problems. Advertising services and health campaigns can help patients recognize possible symptoms of ill health and when to seek help. Step 2. Deciding whether to seek help or not. Some may be unsure if they should see someone about their problem or may not want to be a bother. Others may be unsure about their entitlements or be unduly worried about the impact of their residential status. People with negative experiences may feel hesitant about seeking help. Services like pharmacists, care navigators, NHS 111, NHS Choices, GP practice websites, apps, and other online services can provide help and advice. Step 3. Actively seeking help. Not knowing where to find the right care can be a barrier. A lack of internet access, not being registered with a GP, or confusion about how the NHS works can cause difficulties. For example, some older people may be less confident using technology, and vulnerable groups such as the homeless may not understand their rights on registration with a GP. Others, such as people who are LGBT+, may fear prejudice or discrimination. Active signposting can help people get the right care in the right place at the right time. Care navigators may help patients who find negotiating the system difficult. Step 4. Obtaining an appointment. Obtaining an appointment at a convenient time can be difficult for some who are worried about getting time off work or from caring responsibilities. Access to appointments at a range of times, locations, and different types can help, such as appointments at evenings and weekends in centrally located hubs. Improved training for receptionists will help to support patients in accessing the right type of appointment first time. Step 5. Getting to the appointment. Those who rely on public transport may find access more difficult, especially those in rural areas, on low incomes, or with mobility issues. Working with transport services may help. Technology and newer types of appointments such as video consultations, online consultations, and phone consultations mean that traveling to appointments is not always necessary. Step 6. Seeing or speaking to someone in the general practice service. Communication between health professionals and some groups may be difficult because of disability, language, or cultural differences. For example, visually impaired patients, autistic people, or those who have learning disabilities may need longer appointments or wish to attend at a time of day when the waiting area is quieter. Cultural competency training and access to interpreters will help. Undertaking an equality health impact assessment will help commissioners and providers consider equality issues in improving access to general practice services. For more information on reducing inequalities and improving access to general practice services, visit the links provided.